Hello. Today our topic is about PANS and PANDAS and bringing hope to children with this diagnosis and parents too, of course. That's why we're here. Of course, there's a lot of debate about this diagnosis, how it is picked up, how it is treated, and a lot of questions are still lingering in our culture about how to approach this really sudden onset of anxiety and other symptoms that accompany the PANS and PANDAS diagnosis. So, what is the definition of PANS and PANDAS, you may ask? The short term is pediatric acute neuropsychiatric syndrome, and it's a PANDAS if it's associated with strep. It's sudden onset, like I mentioned. These conditions appear almost overnight with OCD, tics, and eating issues. There may be other issues such as bedwetting and dysgraphia, where their handwriting goes to pieces. We see behavioral changes. In addition to the anxiety, you might see irritability or personality trait shifts. It is definitely infection triggered, although it is more difficult to diagnose which infection it might be that's causing this if it's not strep. How does PANS and PANDAS impact children? Well, we know it's a physical signs, right? Like you see the fatigue, you see the motor tics and issues like that. You see the pain in their expression. They are suffering when they are dealing with this disorder. There's home life disruption. I don't have to tell you this. If you're a parent, you already know the stress on your family from seeing your child suffer and showing dysfunctions that never showed up before, the sleep issues that impact not only the child, but the family at large, and the daily challenges of operating in school and at home. The school struggles, from declining grades to trouble focusing to learning difficulties, and the emotional effects that impact you and your child, such as the sudden onset of fear and anxiety, the mood swings, and the personality changes. So this diagnosis really has a huge impact in a negative way on our families and our communities. We need to understand the brain-body connection. This is something that is somewhat misunderstood by conventional medicine, and that's what my passion is, to bring the education and the teaching around how functional medicine approaches disorders that are chronic in a very different light and spirit. We are looking at the body and the brain and the whole person holistically so that we can address the underlying issues that trigger chronic disorders like PANS and PANDAS, and we need to understand the connection of one to the other and what these triggers are. For example, we know clearly that infection plays a huge role in PANS and PANDAS. It may not always be evident what the germ might be. However, we know that some germ is at hand and is triggering an immune response. We need to understand that what we're seeing as symptoms of anxiety, OCD, dysgraphia, bedwetting, all these things are actually an immune reaction that's happening in the brain as the body tries to fight the infection. We need to look at the brain changes, what is causing the inflammation, and that's leading to the behavioral symptoms. We need to also look at mistaken targets, meaning sometimes antibodies are accidentally attacking brain cells. That's the body's malfunction or autoimmune disorder that's forming. And if we can understand that this is a process and learn which specific autoimmune process is ongoing, we can better address the underlying issue and treat the disease. So again, let me talk about traditional or conventional versus functional medicine approaches. Traditional medicine approaches disease by focusing on symptoms mainly and managing those symptoms, primarily medication-based, not looking necessarily at natural approaches. The standard protocols are for all patients, not customized or individualized to each patient, and we treat each symptom separately, not looking at the whole picture. In the functional medicine approach, we are identifying root causes. We are looking at comprehensive testing, not just one here and there, but looking at the whole picture and comprehensive testing. We are personalizing the treatment plans, and we view the body as an interconnected system, not separate organs, right? So why choose a functional pediatrician like myself? Partly because we do a deep investigation and look beyond symptoms to find what's really happening in your child's body. We have a complex understanding of disease. So we connect the dots between seemingly unrelated symptoms and the test results. We have a diverse toolbox. We use both conventional medicine and evidence-based natural treatments. And finally, there's a family partnership that develops when you work with a functional pediatrician. We work closely with you to implement healing strategies in your home. Our scientific detective work, we take a comprehensive history to start the process. And we gather clues from your child's full health timeline. Even before birth, we're starting to gather information about your child and what's going on in the family history and dynamics. We will do advanced testing to run specialized labs, and conventional doctors often don't use those labs. So it's something that is proprietary to functional medicine doctors. We look at pattern recognition. So we want to identify between symptoms and test results, not just looking at symptoms alone. And we try to connect the dots. And finally, we want to root cause identify, meaning we want to pinpoint the underlying factors driving your child's symptoms. So not everyone who is exposed to strep develops PANS or PANDAS, right? And we need to understand what is that linchpin, what is causing this particular child to manifest this particular set of disease. In our functional medicine toolbox, we're looking at comprehensive testing. Like I mentioned earlier, we run infectious disease panels, immune function assessments, nutrient status evaluation, and gut health analysis. Like I said before, this comprehensive testing is not usually an approach that conventional pediatricians will take, not even conventional immunologists or conventional neurologists for that matter. So it's quite proprietary to functional medicine doctors. We look at nutritional therapy and also therapies that are more natural based. So anti-inflammatory diets. We eliminate food sensitivities. We want to use therapeutic meal plans for each specific patient, and we want nutrient-dense foods first and foremost. We target treatments with herbal antimicrobials, with immune modulators, specific supplements, again, customized to the individual patient, and medications are used when needed. Of course, I am not just a functional doctor, I'm still a conventionally trained and certified practitioner or pediatrician, so I can prescribe if needed. And there are times when treating PANS and PANDAS where we do want to use antibiotics, for example. So that is still something that is at our disposal. So healing the gut-brain axis. And we talk about gut-brain a lot in functional medicine. This is a tenet of how we understand the body works. Things go awry in the gut or in the hollow tubes of our body, and then the immune system is triggered, leading to some autoimmune manifestations as we see in PANS and PANDAS. So we want to test for infections and imbalances in the gut. We want to look for inflammation also in the gut. We want to remove those triggers. So we identify and eliminate foods that may be causing inflammation, infectious agents that may be causing inflammation, or toxins for that matter that may be causing inflammation. We want to then restore the balance with beneficial bacteria and nutrients to heal the gut lining. And we want to support the brain by providing a healthy gut that once the inflammation is reduced in the gut, we also see symptoms and inflammation reducing in the brain. So calming the immune system is first and foremost in our approach. We want to use an anti-inflammatory diet with colorful fruits and vegetables. You want to eat the rainbow, your child to eat the rainbow, and that will naturally reduce inflammation. We want to work on stress reduction because we know that cortisol is going to add on to the inflammatory pathway and inflammation in the body. So it's really important to calm down the stress response. We want to use herbal supplements that calm inflammation like turmeric and quercetin and other herbs that help balance the immune system. And we want to use essential fatty acids. They're called essential because our body cannot make them. We have to take them in and ingest them. So omega-3 fish oil, for example, are known to reduce inflammatory signals. And let's talk about addressing underlying infections. So common infections besides strep include mycoplasma, Lyme's disease, other viral infections like Epstein-Barr, mold can be at play, and sometimes other toxins. So heavy metals, we need to look at all these things. But in the inflammatory infectious pathway, there are testing methods that are outlined here on this chart that we use to detect those types of germs, because each test is so specialized, it's only going to detect that particular line of germs. We cannot do a strep test and expect to detect Lyme's disease, for example. So we have to do different panels for different germs, and we have to be thinking about those germs in our analysis and helping the patient. So once we recognize the pattern of PANS and PANDAS clinically, we then approach the testing to try to decipher and determine the origin of the symptoms. And of course, treatment approaches can vary based on what we're dealing with, whether we use an antibiotic, some herbal therapies, other immune support agents, and immune boosters. Nourishing the brain, I come back to that again and again because that's one of the tenets of functional medicine. We want an omega-3 rich foods in our diet, like salmon and walnuts, really help nourishing the brain cells and lowering inflammation. We want antioxidants from berries and other colorful vegetables, again, to help protect the damage of the brain cells. And we want gut-brain foods, so probiotic-rich, kefir, kombucha, or yogurt, or sauerkraut to help enrich the microbiome and boost our natural immunity in the gut. We want to detoxify our environment, our home especially. We want to be drinking clean water and reducing mold exposure and other toxins in our living space. We want to use personalized cleaning products that are not hormone disrupting or toxic in themselves. And we want to support detox pathways by naturally removing any toxins and also supporting the body with specific nutrients that are detoxifying agents themselves. We want to talk about the power of lifestyle medicine. If you're not sleeping or your child is not sleeping, that's going to increase cortisol and increase brain inflammation. So getting adequate numbers of hours of sleep is so important for brain repair and immune function, and it's something that we definitely must focus on in our healing journey with your child. We want to spend at least 30 minutes of movement every day. We know that exercise lowers inflammation, improves mood, so it's really one of the easy steps to implement in our journey to healing. We want 10 minutes of calm, so meditation, listening quietly to music, all of that is very soothing to the nervous system and calming to the hormones. And we want to reduce symptoms by, helping patients to implement some of those things that we've just talked about, because we know that 85% of patients who do this kind of lifestyle hack are benefited by these lifestyle approaches. We also want to collaborate as parents and doctors with other specialists. So this is not a solo journey. You see in this chart sort of the distribution of the types of doctors you'll be working with on your journey to healing, from neurologists to immunologists to neurologists to therapists and other specialists. So there is hope for healing. I want to just share some stories that have reached that goal of healing their PANS and PANDAS. Several years ago, I had a little girl who all of a sudden developed anxiety and refused to go to school. She was 7 years at the time. Her grandmother brought her to me. She had no symptoms whatsoever. She was not complaining of fever or sore throat or any other symptom. But because of her sudden onset of anxiety, and she had been a child who was very happy and well-adjusted before, I suspected that we were dealing with PANS or PANDAS. So I swabbed her throat in the office, and right there and then we saw that she had a positive rapid strep test. With that, we started her on antibiotics, and within a week she was better. Her symptoms had gone away. And at the time, I understood that she needed to be on a little bit of a long-term antibiotic therapy. So I put her on probiotics, and she continued the antibiotics for about a month. And then she stopped, and I lost her to follow-up. I actually didn't see her for several years, but when I did see her recently, she was still doing well. She had never had a flare-up again, and we caught her symptoms extremely early, so we were able to heal her symptoms and heal her body, and she never remitted anymore. Like, she never had a relapse rather anymore. I've had another teenager come to me this year. They'd been on vacation, and while on vacation, she started developing hallucinations, like visual hallucinations and anxiety, and just projecting out a lot of fear for like this. Her vision was distorted. She was just hallucinating and seeing things, and she was expressing the fear from that and feeling like she wasn't herself. So as soon as they came back from vacation, we talked about her symptoms, and of course I recognized again the pattern of sudden onset of anxiety and OCD, and in her case hallucinations, and quickly started testing and treating, and right now I can say she's stable. We unmasked other things that were going on besides strep. In this case, she had not only strep, but she also had mycoplasma and other antibodies that were extremely elevated. So we're working on an autoimmune diet and autoimmune supplements, and she's now stable, back in school, doing well. Of course, all these patients, with PANS and PANDAS have to be vigilant that they could have a relapse at any time and may not be out of the woods for some time after. So it is a journey that needs to be continued, and not to relax and go back to, a normal diet, if you will, a standard American diet that we lived before the onset of the symptoms. It is something that you have to be vigilant and monitor progression and monitor for flares. So whatever diet we start, we usually stick with, and whatever supplements that are anti-inflammatory, we stick with. But the antibiotics can come and go depending on what's going on in the child's life and what flares might be happening. So what to expect on your journey if you work with a provider like myself. We'll have an initial consultation, and through a thorough history taking and preliminary assessment, we can usually determine clinically if your child is dealing with PANS and PANDAS. Beyond that, we will start comprehensive testing, because I want to rule out and determine what are the underlying germs that could be contributing to the symptoms of PANS and PANDAS. We would begin a treatment plan specifically developed for your child's needs. I do still use ibuprofen. I do still use a lot of the conventional medical tools, but in addition to that, we use diet, we use lifestyle hacks, we use supplements and herbs like we mentioned earlier, the omega-3, the turmeric, the quercetin, things like that, to help minimize inflammation and also minimize the regrowth of the bacteria or viruses that are causing some of this trouble with the inflamed brain and autoimmune disorder. We will be implementing the diet, the supplements, the medication as needed, and I'm guiding you along the way each step. There'll be a lot of questions usually throughout that journey, but once we get to a steady state and we see remission, it's usually much less aggressive. My involvement is less intense at that point, and we're just coasting and sort of touching base periodically so that we can monitor progress and intervene if there's a flare, and kind of follow up as needed on that journey. So I want to empower you as parents in your role in healing. You want to educate yourself and learn as much as you can about PANS and PANDAS through reputable sources like aspire.care or the pandasnetwork.org. Implement changes in your family, from diet to lifestyle to supplement protocols. Track the symptoms, because you're the ones who are going to notice if a certain intervention is relieving the symptoms or contributing to more symptoms. You're going to see the interactions and the side effects and all of these things. So tracking the symptoms and comparing with everything you change is going to be very informative to your doctor, to myself, to your specialists, and to you as well, because it's really going to help guide how you proceed day to day. I want you to communicate to your child that they're going to do well, that they're going to heal. Support them in that belief. I want you to communicate to the therapists, because you're going to need some support for mindset control and mindset positivity, basically, in the child's life. We want to communicate with the teachers and other providers to help support the successful journey of the child, and really maintain hope, and remembering that, healing is very possible. This is very much a reversible disease if we know what we're dealing with exactly. It's just not reversible when we don't know all the parameters and we're missing some key element to the healing journey. So as much as we can do testing upfront and support upfront, we want want to do that along the way. So more resources and support for you are some books I've listed here. The PANDAS Network and Aspire.care are other supports. You may find local support groups in your town. Molecularlabs.com is another resource. They do a lot of the testing to determine PANS and PANDAS. Also, PANDASPPN.org is another organization that helps providers like myself learn about PANS and PANDAS. Many pediatricians unfortunately have not even heard of the term or that diagnosis. So educate your providers so that we're all a team. You need a village, to be honest, to help a child with PANS and PANDAS. It's not a solo journey. You need all the specialists we talked about before, and definitely some therapists as well. So let's make this a team effort, but there's definitely hope and there's definitely a light at the end of the tunnel. So your next steps, if you wish to work with me, is to apply for a consultation on PANS and PANDAS. Let's talk about how we can help you and your family move forward to healing. We'll want to document your child's symptoms, timeline, any previous treatments you've done. If you sign up with me and start working with me, it'll be an initial consult of 90 minutes after that initial free consultation. And we begin the journey to testing and to treatment. So my goal is to give you hope that we have a path that we can move forward toward healing and renewing health. And this is not the end of the road. This is not the end of the story. PANS and PANDAS does not get to win. We are smarter than it, and we have solutions and treatments. So I really want to trust that you have heard the message that you needed to hear for your child, for your family. Don't give up. Contact me if I can help in any way, and let's go forward. Thanks.